healthcare system, we do have a fundamental problem. We have a fundamental problem that we have lost our way with regard to, and I'm going to throw the educators into this as well. I mean, we live in the land of hedge funds, and you know, the best and the brightest of Harvard are running to, you know, to work in a hedge fund in Greenwich anymore, and not trying to spend their time figuring out how to solve the medical problems of this, you know, in society. And you know, and it's sad. I mean, one of my college roommates was a Rhodes Scholar, and you know, interesting you bring up DeBakey because he was the one involved in the creation of LASIK surgery, and he's kind of the eye doctor, the ophthalmologist to the stars, if you will, out in LA, a guy named Robert Maloney. And I would say to him, Robert, your fundamental problem is you have a DeBakey problem. DeBakey only handles the toughest situations. And his reputation got built by handling the toughest of situations. Not, you know, stents became easy for anybody to do, right? I'm sure that 2 or 3 years from now, we're probably going to have a robot do it with no human whatsoever, right? I mean, it seems that we go that way on a lot of stuff. But I would turn to Robert and say, how can you charge $4,000 an eye when everybody else charges $300? And his line was very simple. He looked at me and said, I'm just more careful, right? It's like, you know, you're dangerous. But we've lost the best and the brightest with regard to reward and reimbursement, and as a result, just like a lot of other things, we are filling in, you know, and we have a massive problem with the front line of healthcare. When you look out 10 years or 20 years with regard to primary care delivery relative to the needs of the population. Take our aging population with the in our geriatric needs. We haven't even trained anybody in that. And it's massive, right? And so, you know, I've been encouraging people to kind of become nurse practitioners or to become, you know, PAs, because fundamentally, and you know, we implemented a program where we substituted nurse practitioners for physicians on basic elements of stuff. And it drew a big hullabaloo for a period of time, but it made a lot of sense. Because we do have to fill the front lines. We do have to fill, and we've got a massive issue, and I think that we need that. This is a radical proposal, I just thought of it, but the state of Massachusetts, you know, the scary thing is we're using the state of Massachusetts as a model, and I don't know if anybody's ever really dug in. I've sat with and looked at it in general, but in pretty specifically. They punted on all the hard discussion. So the subsidies to the hospitals with regard to uncompensated care pool, do you guys know what that is, the uncompensated care pool? 10% of your insurance premium pays the hospitals to treat the people who allegedly aren't covered. So in this country, everybody's fundamentally covered the moment an emergency room admits them in, which is why people shut down their emergency room, right? Well, there was $450 million worth of subsidies that the government said keep. But wait a minute, everybody's covered. So there's no such thing as uncompensated care anymore. But rather than get into the political fight, yeah?
We see a whole lot of undocumented immigrants living there.
Well, but it's, you know, relative to the 450, it's like 20, right? The point I'm making is take that money, create scholarship programs to invite people to participate in the medical community. And one of the things I think is interesting with Kaiser that I do think really works is if you're a physician having to go to medical school, you cut a deal with Kaiser, right? You don't come out with debt, right? It's like you owe them 3 to 5 years worth of work, and you've built a practice, you have no debt, because I can't imagine coming out of college with $400,000 worth of debt and figuring out in this reimbursement system where the government is now going to be 60 to 70% of the payer, paying on Medicaid fees, not on fee-for-service fees. So 30 to 50% on the dollar on reimbursement. How am I going to make that back? It's going to take me 30 years. And I'm the smartest kid in my class. Shouldn't I just go work in a hedge fund? So, you know, that to me is, we have this fundamental societal issue and that's one of the reasons I do think that the Kaiser model, and the other part to me is what we're not arguing about is where's all the money in the healthcare system and how we reallocate the entire money to say we need new entrants in the system, how are we going to subsidize and support them? How are we going to encourage the best and the brightest to continue to stay in keeping this country where we fundamentally have always been. We argue that we are the best. We export the genius, right? And the scary thing to me is that pharma has now decided R&D won't happen in this country. They can't deal with the FDA anymore. So it's like easier to just go do trials all over the world than it is to do it in this country. So granted, the company may still be housed here, but the intellectual property is starting to move itself to other places. And that to me is one of the other parts of the bigger issue, right? When I say that healthcare hasn't changed, we still pay the same way. We still use antiquated ICD-9 codes, right? We have 93,000 codes, I think, and not one for preventive medicine. Not one to reimburse you for being better without having to come see me, right? We still educate the same way. We still put the doctor, we still have malpractice insurance the same way. So we fundamentally still bill and charge the same way. We have claim systems that are screwed up because we don't have a systematic standard on things, right? I got dragged in front of the RICO lawsuit. I was witness number 9 out of the 10 because I said that we should be in a spirit of co-opetition, not competition when it comes to claims. How dare a health plan compete against another health plan on their ability to process a claim? We should be able to do it automatically within 24 hours and reimburse. If we had one common code, which is basically, VHS and Beta had a war, they solved that one. We've got 27 different ways of paying. Why are we competing on that? That's what I get at when I say that the fundamentals are.
All right, Jay.